Thank you for downloading another episode of Your Life Simplified. My name is George Fernandez, and I'll be your host for this episode. As we work with our clients, we help them make very important decisions in their life. And as advocates and fiduciaries, we cover a wide variety of different decisions that they have to make. And one of the most important decisions that every client makes at some point is a decision about Medicare. Medicare can be a little bit challenging at times, as we're going to kind of talk about today. And what we want to do today is kind of unpack that a little bit to help you understand some important factors about Medicare. And to help me with that today is Joe Hendrix. Joe is a senior wealth advisor, CFP, and CPA out of our Oklahoma City office. So Joe, welcome to the show.
Thank you, George. Happy to be here.
Great to have you as well. You want to tell folks a little bit about yourself?
Yeah, absolutely. I'd be glad to. Well, as you mentioned, I'm a senior wealth advisor with Mariner here in Oklahoma City. My role with Mariner is to work with my clients as their financial thinking partner and help them make all those important financial decisions, big or small. I'm a certified financial planner, certified public accountant. I started my career in public accounting, working on the tax side of things, and then saw the light and realized there was an opportunity to do more for clients than just their tax returns. And I was fortunate to join Mariner and help our clients with everything that's finance in their world.
Well, it's great to have you here. And, this is a topic that you and I spend a lot of time talking about. And what folks may not know is you and I actually go across the country speaking to clients about this very topic. And I really enjoy getting out there and having these conversations. And what I discover in having these conversations is that every situation is so nuanced. And there's no one situation that's exactly like the other. So as we share the information today, just know that we can't make you experts on the topic. We'll try to share with you what our clients are asking when we talk to them and what we hear at these presentations. But most importantly, your situation is very unique, and you want to look at how it applies to you. So today, we're going to dig right in, and we're going to talk about three big questions that most of our clients are asking about Medicare. Who is eligible? When do I enroll? And what are my options? And so let's dig right in. So Joe, thanks again for helping me out today. So let's begin with that very first question with who is eligible?
Yeah, so eligibility is determined by a couple different conditions or criteria. First, which is probably the vast majority of the folks listening in today, are going to be anybody who's age 65 or older. So once you turn 65, or really right before you turn age 65, you're going to start to receive some letters in the mail from Medicare about signing up for your benefits. But you can also wait past age 65. There's certain situations where you can wait, and we're going to touch on that here in a little bit. There's also, for those who have certain disabilities, you can apply and be eligible for Medicare if you're under age 65. Further, any age, if you have end-stage renal disease or permanent kidney failure requiring dialysis or kidney transplant, can also be eligible for Medicare at any age. If you'd like to learn more, Medicare.gov does have some links and resources that can help determine what those certain disabilities and such might be that can allow for eligibility before age 65.
Yeah, it's really that before age 65 that you may have to go out there and make some inquiries. But the reality is for most of us, when we turn 65, the one thing that's going to happen is you're going to get notification from the Social Security Administration or Medicare.gov, and they're going to actually send you a book that says you and Medicare. I think is what the name of it is, if memory serves me.
Yeah.
And so it's a 125, 126 page book that kind of goes through all these different pieces of Medicare and how it applies to your personal situation. And we'll speak to some of the things we're talking about today. So it's a great resource to have too. This is also really important for those of you listening who maybe are under the age of 65 or listening because you have parents who are approaching this age. Know that these resources are available for you to help them walk through these decisions as well. And of course, reach out to your financial advisor to help you through that decision. So let's kind of shift gears and talk a little bit about when do you enroll. And I think this is where it gets really important to watch dates as it relates to the when piece of that. So let's start with the when to enroll. Your initial enrollment period begins when?
So an initial enrollment period is essentially the 7-month period around the age you turn 65 or the month you turn 65. So that's going to be 3 months before your 65th birthday, and then the month you turn 65, and then 3 months after you turn 65. So it's that 7-month period. And it's going to be the time where we generally encourage clients who we know at age 65 are going to be applying and signing up for Medicare, that once that booklet gets in the mail, now's the time where we can get on Medicare.gov and start the process to sign up for your benefits. if you sign up during that 3-month period before your 65th birthday, then you're not going to have to worry about having any types of delay in coverage. And so that's really the best time to do it because you don't have to worry about any delays.
Yeah.
And then, but if you sign up after age 65, you might have a slight delay in coverage because you're going to have a few months where you may not be covered at all.
Yeah, so really important. So that date, the key date is age 65, so your 65th birthday.
Yeah.
So right now, if you're not driving, go to your phone and put a reminder on your calendar, 3 months, 4 months before your 65th birthday, to send a reminder that you need to check into to Medicare, or maybe the year before when you're working with your advisor. So hopefully they're helping you track this as well. But that's a really important thing. We got these tools, why not use them, right? It's kind of the way I look at it. So when we think of enrollment, so that's the kind of the standard enrollment, but there's also a couple of other enrollment periods that people may not be aware of. So if unfortunately you miss that date, while it's not necessarily the best news in the world, all is not lost, right? I mean, you still have other options. So our other option is what?
Yeah, so one is if you're age 65 and you're not on some type of employer plan, and we're going to cover that here in a moment, but you're purely where you were intending to sign up at age 65, but you missed that window, well, you still have an enrollment period called the general enrollment period. And what this is, it's a window that's opened 3 months every year, January 1st to March 31st of every year, for those who are eligible for Medicare but didn't sign up in their initial enrollment period where they can get coverage. But the kind of one of the negatives is your coverage doesn't actually start until July 1st of that year. So if you are signing up through the general enrollment period, you have essentially guaranteed that you are going to have some type of lapse or no coverage at all. And so, and finally, it is also subject to a late enrollment penalty for the remainder of your life. So it is something that you will be financially penalized every month when you make your premium payments, where you're going to have a little bit of a penalty every month.
Yeah, exactly. So this is kind of like the Social Security decision that we make, at some point in our life as well. You only get to make this decision one time, so you want to be very mindful of the dates and mindful of the options, and we'll talk about options here in just a moment, because it can, have a lasting impact on our lives. So that's really important.
On that general enrollment period, one other thought that's pretty important is that, if you think about the maximum amount of delay you could have, you could actually go 18 months without coverage. If you turn 65 in December of a year, but you don't actually sign up during that initial enrollment period, you're going to have to go 18 months, a full calendar year plus 6 additional months before you actually have coverage. And so, again, you're really taking a gamble that if you've had some catastrophic event, you would have no health coverage whatsoever.
Yeah, very, very important and great reminders. I appreciate that. So keep that in mind. Mark those dates on your calendar, put it on your phone as a reminder, talk with your advisor, have them put that on their calendar as well. We should all be looking very, very closely at those dates so we don't miss that. Also, remember, too, that general enrollment period, that if you're trying to get help during that period by calling up and asking the insurance carriers to provide you that coverage, there may be others that have, unfortunately, dealing with that same situation. So you could be looking at higher call volumes during that period as well. So may even take longer to get it all set up. So just be mindful of that. I think it's really great and important. Now, you also mentioned that there's a kind of a special enrollment option available. And I actually know someone who used this strategy. They actually continued to work till they were age 70. They worked for a large employer. And their particular employer covered them on their insurance, that group health insurance, until they were at age 70. So then, in fact, they actually had a waiver or something like that. Maybe you can describe that just a little bit for their medical coverage, and they didn't go on Medicare until age 70. And they weren't subject to that late enrollment period because they had this special enrollment condition. So you want to describe that just a little bit?
Yeah. So special enrollment period is essentially allowed for those who are still working at age 65 and still have eligible coverage from an employer plan. And that eligible coverage is dependent upon the number of employees that the employer employs. And so most of the time, that special enrollment period is going to be available for anybody who's turning age 65 and still working. I do encourage it, when you don't just make that assumption. It's really important to discuss with your HR representative at your employer to make sure that you have an eligible plan. That way you don't think that you're in a special enrollment period when it turns out you were not, and then you have to be subject to that general enrollment period. So that special enrollment period essentially happens once you cease employment and you lose that coverage. It's typically when you decide to retire. We might have a situation where somebody's planning to work till age 67 once their Social Security full retirement age hits, or age 70. Well, in that case, what we encourage is once we start honing in on that date, that retirement date, that we start thinking about, well, let's plan for this special enrollment period. Let's go ahead and start the process of getting signed up. That way we know, well, my coverage is going to stop in June. Well, let's plan for it, and let's get coverage picking back up right in July, so you literally have no gap in coverage. The special enrollment period you do have 8 months after you lose that coverage to be able to sign up for Part A and Part B. But again, I would encourage you not to wait that long, because you could have a delay in coverage depending on your particular facts and circumstances.
Yeah, great reminders again. And so again, that's a friend of mine did that, and they actually started looking at their options I think it was about 7 months out. So they were all ready to go. They had all the documents ready to go right into it. So really important.
And that's where I view, as a financial planner and an advisor for clients, that's really our role is, if we're having those right conversations and that dialogue with our clients, we know when that retirement date is for the most part. Sometimes there's certain situations where it's more of a surprise. But for the most part, we're anticipating that. We know it's coming, so we're helping our clients plan for that in the right manner.
Exactly.
Thanks again for downloading this episode of Your Life Simplified, which is produced by Mariner Wealth Advisors. And at Mariner Wealth Advisors, we're here to serve as your advocate. We help people chart a course to reach their personal and financial goals so that they can have greater peace of mind that may lead to a more fulfilling life. We do this by always putting our clients first. Because as fiduciaries, we're required to provide guidance that's in the best interest of clients, not in the best interest of a company or shareholders or anyone else. So as you listen to this podcast and have questions about maybe your own financial situation, or would simply like a second opinion, or even you have an idea for a future podcast, please go ahead and email us at podcast@marinerwealthadvisors.com. If you found the information on this podcast valuable, please go ahead and share it with a friend or family member that you think might benefit from this information. And please don't forget to subscribe to this podcast so you don't miss an episode. Thanks for listening, and now back to the episode.
So the last question that we have here is going to get probably a little bit more complicated here now. So it's really more about the options, right? Because, you like to think it's straightforward. We hear a lot of talk about Medicare for all. It's actually not as straight. In some ways it's straightforward, in other ways it's not. So we're going to talk about now what are our options when we get into Medicare. And they're really 4 parts. There's 2 bundles and 4 parts is the way it's typically described. You got the original Medicare, you've got Medicare Advantage, and then you got pieces that kind of belong and roll up underneath each of those. So let's break this down into each of those separately. I think it's probably the best way to go into this. Let's talk about original Medicare first. There are 2 parts to the original Medicare. You got Part A and Part B, and then you may have some supplemental coverage that may come into apply to that as well. So you want to share what Part A, Part B we can expect on those coverages?
Yeah, absolutely. So when we think of original Medicare, it's comprised of multiple different parts that all coordinate together, and they're all working together, and they cover different things. And so with original Medicare, we're going to the main 2 components that pretty much everybody's going to have is Part A and Part B. Part A is our hospital insurance. And so essentially what this is if you have some type of more sudden event and you go into the emergency room or admitted to a hospital, something like that, your Part A coverage is going to cover those costs. Part A is also the part of Medicare that we're currently paying into. So if you're an employee or a business owner, those Medicare payroll taxes that you're submitting every paycheck or every quarter, that is paying into Part A. And for the most part, if you're eligible for Social Security benefits, you're going to be fully paid into Part A, and you won't have a premium for that. There are some other costs to Part A, though, that can happen. There is a deductible. There is some coinsurance. Those can all be smoothed out through supplemental coverage, which we're going to talk about a little bit. But one thing on the deductible, in 2019, that deductible was $1,364 per benefit period. And I want to caution that because a lot of times when we think of deductibles, we think of that as an annual deductible, that once you hit it, you're there for the year. Well, with Part A, it's per benefit period, and that actually is relating to more of the condition or the situation that caused you to be in the hospital. And so, I like to use more of an extreme example here, but you might have a case where you break your left leg and you go into the emergency room, they get you fixed up. That's a benefit period. And so once you're cleared for that and you leave, well, you're going to have a deductible for that benefit period. And let's say that I'm leaving the hospital, I walk out and I break my other leg. Well, that could be a different benefit period. So you could, in turn, without some type of supplemental coverage, have multiple benefit periods throughout the year and then multiple deductibles on that.
Yeah, it's a really great point. In addition to that hospital care, there are some other elements in there too I want to point out. So we just talked about the inpatient care, there's skilled nursing facilities, there's hospice, there's home health care. Now, I want to be real clear on this in that when we say skilled nursing care, that is not long-term care coverage. That's coverage for when you have an inpatient care event, like what you just described. Let's say it's a hip instead of a leg and you need to have rehab. They're going to send you to a skilled nursing facility to go through that rehabilitation, and you have coverage for a period of time in that event. Once you plateau or once you reach a point where you're not improving necessarily and you're sent home at that point. There's also another element here I want to throw out there too that's called home health care. A lot of folks don't really understand that this actually exists. And what that is designed to do is for those individuals who struggle getting to the doctor's office because it's just physically difficult for them to get there. There are opportunities to have that lab work or those nurses, nurse practitioners come out to your house and actually provide some level of care for you. So it's not the strict care if you were in a skilled facility, of course, but it does allow you to do some of that checkup work without having to get out of the house. So that was really important for us in my case. My mother-in-law lived with us and she couldn't physically get out. We could actually use that home health care benefit, and our doctor was the one who actually told us about this. We didn't even know it existed.
Yeah, those are really powerful options to have. And a lot of times people don't realize that they have those options. And again, I think that's really working with an advisor or your medical team as well, just to understand what options you do have on that.
Yeah, exactly. So that kind of takes us to the Part B, medical care, which is really more around the doctor's services, that outpatient care that you need and the potential medical equipment that you need. Anything else you want to add to that?
Yeah, I think, one thing that just on Part B is it's more of your traditional doctor setting, so going to my primary care or specialist and whatnot. But I think that one thing to illustrate, too, is that Part B is a premium. That is one that typically you're going to have a monthly premium that's going to be associated with that, and it's income-based. And so you can have higher premiums than others. It all depends upon your income, and that income, it looks back at the prior 2 years or the previous 2 years to determine that premium level. For most, we see the lowest in 2019 was $135 a month was that monthly premium for Part B. And there are some other costs that can come with Part B, copays, coinsurance, and so on. And there is a deductible as well. But again, supplemental coverage can help smooth those costs.
Let's talk about Part D, which is also part of this Medicare, original Medicare piece. And that's really the prescription coverage. And I think the quick reminder here is that this is combined with your original Medicare, but it is managed by a private insurance company that you will go through directly. And it's designed to help cover the cost of prescription drugs. Now, key thing here is that I've learned is that it can be a different plan for husband and wife. And so because it's all kind of based upon the prescriptions that you have, so you do want to look at this very, very closely as, when you are shopping this, and you can shop by price, basically. You go in and you provide a list of all your medications, what it's for, the conditions, and look at the ones going to give you the best pricing for that. Just like your employer, there are formularies that they use to determine the pricing structure for that particular patient, and you want to look at what's going to be in your best interest when you do that. So anything else you want to add on that?
So, George, on that then, it looks like, so with Part D, since it's private insurance companies, that's going to be a premium you're going to pay directly to those private insurance companies.
Yeah, exactly.
Okay. And then so on our Part B, once we get on Social Security, your Part B premiums are actually withheld from your Social Security check. So a lot of times you may not see or actually physically write a check for those Part B premiums, but Part D is a separate premium you pay outside.
Yep, exactly. So I guess now we'll talk about the other option. So we talked about original Medicare, we talked about Part D and how they kind of work together. Let's talk about Medicare Advantage. Medicare Advantage is one that those are the ads we see on TV all the time, all on Medicare Part C or Medicare Advantage. That's a little bit different. It's called Medicare Advantage, but it's not technically the same as original Medicare. So how is that different?
Yeah, so I think Medicare Advantage is, first, there's no right or wrong. Everybody's different on which side they go on, original Medicare versus Medicare Advantage, because there are situations where Medicare Advantage makes a lot of sense. But one of probably the most, what I'd say is the biggest distinction is for the main kind of coverage, that medical insurance is it's offered by private insurers. And so it's not going through Medicare. You're going through a private insurer, which means that you're going to have it's more of a network based. So you're going to have, a group of doctors who are going to be part of your Advantage plan. So one caution there is if you sign up for it, it's possible that you're, a doctor you've worked with for years that know you have your history may not be on that plan. So you want to confirm that, who is on that. But there's some folks that don't really have that type of relationship with their providers, and so they can make those switches without that. And the other thing that it can have is every plan's different on the Advantage. Some don't have, they may not have deductibles. They may have low coinsurance copays. It may be just premium only. They may include dental and vision on that. So it's really where I think we've seen over time these Advantage plans have become a little bit more robust, but I think there are limitations to them where they're not right for everybody, but that also doesn't mean they're wrong for everybody either. It just really depends on those facts and circumstances.
Yeah, it's a really great point. I always kind of use the example when we're speaking. My mother-in-law was always an original Medicare recipient, if you will, and my father was always a Medicare Advantage. Since the time that he was eligible at 65, he has only been on Medicare Advantage plans. And he's 91 years old, and generally it's been a really great experience. But there's been one thing that's been always the biggest challenge, and that is Medicare Advantage programs change, and they close out. And so he'll be on it for 3 years or so, and then it changes, and then he has to get a new plan. So most of the time it's not really a challenge, but there have been times where we've had to actually change networks and change doctors, and so it's getting all that transfer taking place. So that actually, it works, but yet we just need to be managing that too. So it's just an extra step. In addition to that, from a travel perspective, it was easier for my mother-in-law to have original Medicare because she traveled a lot, and so that was going to be available to her, pretty much anywhere, versus a Medicare Advantage plan like my dad's situation where he's only traveling locally, generally speaking, and so this region was fine for him from his network perspective.
That's a great segue, George, because I was planning to ask you this question, but is it important for those who think they may move to a different state in retirement, maybe get closer to children or get away from children possibly, to have an important consideration on which side you go down?
Oh, yeah, absolutely. You want to be, if you're looking at Medicare Advantage and you're planning on moving to another city, you want to know what that Medicare Advantage plan is going to look like there, if it's even available, or vice versa. So absolutely, yeah, you want to look at those things really closely.
Because I think that, I didn't really stress this much on the original Medicare side, but I'd like to recap this, is that on the original Medicare, any provider that accepts original Medicare will accept you as a patient. And so that really can be important because it opens up that network to a much wider array of potential providers.
So what's not covered under Medicare? These are things that we want to make sure everybody understands too and walks away with. That what's not covered is home or community-based care, assisted living facilities in the sense I was mentioning a little bit earlier, outside of the rehabilitation, nursing homes, regular eye exams, hearing aids, and routine dental care. Those are really important things to know because those will be decision makers for you depending upon your personal situation.
Those are so important to know, George, because I think from one standpoint, I like to talk about with clients that on those long-term care type facilities that Medicare covers short-term stints in those facilities, not the full. So it's really, 20, 30 days is your coverage level. And then finally on that, what's not covered is, on that dental and vision, to know that you may have to have another policy outside of that. So that might be when you're going through that process to get your Part D prescription drug coverage, to go ahead and also get your vision and your hearing coverage as well at that same time. That way you're fully covered.
Exactly. So as to which plan is best for you, I think it's important to look at the original Medicare, the Medicare Advantage side by side. Have a specialist look at those, compare and contrast each of those, and describe how they're going to work for your personal situation. Because it is nuanced. You may find that, again, you may have a spouse be on Medicare Advantage, you may have a spouse be on original Medicare, because that provides the best coverage for you at the most cost-effective approach. So just know that you do want to take care in looking at this because you only make this decision one time. As we wrap things up, I guess one of the things we want to probably just wrap things up just real quickly, the supplement plans. We could spend probably a whole day talking about supplement plans, but can you just give us a quick view of what a supplement plan is and how it's applied to original Medicare?
Yes. So a supplemental plan essentially helps you smooth out costs. It does not change your coverage level. It doesn't all of a sudden make vision or dental an option, but it simply smooths out costs for that. And it makes your overall annual costs a little bit more certain, where you can budget for these items. So what that really means is that, earlier I mentioned about the Part A deductible of for 2019 was $1,364 per benefit period. Well, depending on your supplemental plan, and there's about a dozen of them, different types, you may be able to purchase a supplemental plan. It's a monthly premium, and it's with a private carrier who will, depending on the type, would avoid that deductible. They can also have some that can avoid the coinsurance and the copays and the Part B deductibles, the Part B excess charges. And so there is a variety of them. And we generally look at, well, if you can, cash flow wise, it makes sense, go ahead and get one of the better supplemental coverages, which generally is Plan G or Plan N. Those are the two we see the most. And the reason is because they generally cover everything, the additional items for Part A, Part B, and so on. And really, I like it because it just makes it where we can budget for our health insurance costs.
Yeah.
We know how much it's going to cost every month. There's no surprises where if you have, a year where you have three different kind of, costlier type situations that go on, different, or worst case, you get some form of really bad illness, and all of a sudden you're using your health insurance a lot. I think the supplemental just helps you smooth that. Now, there may be some years where you don't use it as much, and so it's kind of a lost cost that you're just losing those dollars. But I generally think from a planning perspective, I would much rather have a certainty on what my costs are as opposed to rolling the dice and taking the chance that I might have some situation where I could have higher costs.
Yeah, that's a really great point. I think we could probably have another episode just on the supplemental plans themselves. So I appreciate you giving us that quick rundown because, as we said before when we first started, this is a lot of moving parts here. We want to make sure that we're looking at this critically for our own situation. Yeah, I appreciate you being here today, Joe, again, as I said. And those of you listening, we really thank you for being here today, and we really want to hear from you. So let us know what you think about the episodes that we're sharing with you, and let us know by emailing us at podcast@marinerwealthadvisors.com. Thanks again for being here, and we'll see you next time.
Wealth Advisors, or MWA, is an SEC-registered investment advisor with its principal place of business in the state of Kansas. Registration of an investment advisor does not imply a certain level of skill or training. MWA is in compliance with the current notice filing requirements imposed upon registered investment advisors by those states in which MWA maintains clients. MWA may only transact business in those states in which it is notice filed or qualifies for an exemption or exclusion from notice filing requirements. Any subsequent direct communication by MWA with a prospective client shall be conducted by a representative that is either registered or qualifies for an exemption or exclusion from registration in the state where the prospective client resides. For additional information about MWA, including fees and services, please contact MWA or refer to the Investment Advisor Public Disclosure website at www.advisorinfo.sec.gov. Please read the disclosure statement carefully before you invest or send money.